the floor is yours, Craig.
All right, great. Thank you so much for having me today and giving me the opportunity to talk about something that really has become just one of the biggest parts of what I do. And it's kind of interesting how I fell into it. And I think it's worth giving you just a little bit of background of how this whole process and this whole course came about. Briefly, I began working at a state mental hospital in the late 90s, and from there began seeing people with intellectual and developmental disabilities at a regional center right across the highway. And one of the first things that I learned is how incompetent I was to actually provide healthcare to people with intellectual and developmental disabilities. I realized very quickly that I simply did not have the training that was needed. So I spent a lot of time learning. I learned a tremendous amount from the nursing staff, the direct support professionals, the people with intellectual and developmental disabilities themselves over the next several years to be able to finally come to a place where I felt I could provide at least a basic competent level of healthcare to people with IDD. In 2011, the Department of Justice came into the state and said, and this was in the state of Mississippi again, came into the state and said that we were relying, too heavily, as they've done in many states, too heavily on institutional care, and we needed to have more opportunities for community supports and services for people with IDD. That was concerning, but whenever I hear things that I'm not familiar with, I try to learn more about them. And so one of the things that we did is we put together teams of people that went to other states that were a little further along in community supports than we were, and learned a lot. And one of the things I learned looking at things from a healthcare provider perspective was that there were a lot of challenges in people moving into community settings and getting their healthcare needs, finding healthcare providers who understood their medical issues, medical complexities, the relationship between behaviors and communication and medical problems and things like this, which are things that I learned the hard way. And my first thought, quite frankly, was that people are going to die. And I know that seems harsh, but I knew that when I knew what I didn't know, and I knew that many people with complex health needs who would be moving into community settings would be seeking healthcare from community-based physicians who learned or didn't learn the same thing that I didn't know initially, and that was very concerning to me. So that became a mission for me. I sought to try to provide education and training, and I was able to receive a grant in the state to create a program called DETECT, which is the Developmental Evaluation Training and Educational Consultative Team of Mississippi. And we provided education, training, and some consultations for community-based providers out in the community, seeing people with disabilities, for medical students. And I began to formulate a group of lectures, a group of talks that I felt were teaching the fundamental things that anyone who worked in this field should know. And I basically nudged my way into state medical association meetings, physician meetings, nurse practitioner meetings, nursing meetings, trying to get this information out there. And as time went on, I began to organize this information a bit more. Then I, quote, retired in 2018 from my work with the state, and that was when I retired from my clinical practice, to begin to work with IntellectAbility. Our missions, my personal mission, aligns so well with the company's mission, which is really to provide tools and training to supporters of people with intellectual and developmental disabilities, and to help them recognize health risks, health destabilizations, know what to do about them. So over time, I was able to formalize this information that I had began putting together years earlier into a course, which was able to be turned into an e-learn course. And that's what I'm going to tell you a little bit more about today. So that's kind of the background. It happened very organically and really very much out of a personal need for me that I became aware of, to be a national and really a worldwide need, which is to provide or have a way to provide education and training to healthcare providers in this field. So I'm working to raise awareness of this issue to get it better utilized. And again, I'm actually very excited to see what's happening and what's going on and how things are moving forward in this field with this particular committee that we have here, the grant that has, that we're all working with here, and some other things that are happening in the field. So what I will tell you about is the course called the Curriculum in IDD Healthcare. It is an online course for really any type of healthcare provider or person who works in a related health field that takes care of people with intellectual and developmental disabilities, provides healthcare support for people with intellectual and developmental disabilities. It's geared towards physicians, nurse practitioners, physician assistants, nurses, dentists, and really any other clinical personnel as well. The purpose is specific. It's not a catch-all that's going to teach everything anybody needs to know in 5 minutes. But the purpose is to concisely teach fundamental principles of providing healthcare for people with IDD that every clinician should know. It's to provide the foundation of knowledge that I wish I had when I started many years ago. So in general, it is an online interactive e-learn course, again, that teaches the fundamentals of IDD healthcare. Now, we talked about one of the things in the micro version that it should necessarily always be physicians teaching physicians, which I completely agree with. Again, I learned so much not from physicians, but from other healthcare providers who have been working in this field. But a lot of physicians do like to learn from other physicians, and it is written and delivered by a physician for our physicians and other healthcare providers. There was input from clinicians, mainly through Augusta University, who reviewed the course, different disciplines of physicians, as well as advocates, and their input was carefully included in the final version of the course. There are 6 modules that make up the curriculum. There are interactive knowledge checks and post tests included. So it's not just something you sit and listen to. And one of the things that we felt was very important for a physician or a nurse to spend time learning about something, it sure is nice to be able to get continuing medical education credits or continuing education units. So the course is approved by the American Academy of Family Physicians for 5 CMEs. And those are translatable to any physician discipline because they're equivalent to AMA Category 1 credit. And it's also approved by the Ohio Board of Nursing for 6 CEUs, and it's just a difference in the way that the approval process went. And the delivery of the certificate is automated in the course. Once you finish the course, you automatically are directed to complete a survey, and your certificate is automatically delivered. So I'll tell you a little bit about the course. The first module is IDD healthcare, then, now, and next. One of the things that we need to do I think, is to create a framework for where we have been in the world of providing healthcare for people with IDD, where we are now, and where we're going next. So that's what the first module is about. The second module is a very clinical module, healthcare basics in IDD. In that module, we talk about the fatal 5. We go into them in detail about aspiration, seizures, dehydration, constipation, gastroesophageal reflux disease, sepsis. And it doesn't teach, for instance, how to take care of aspiration pneumonia. These are things that clinicians understand. But what it does is it teaches how aspiration pneumonia may be more prevalent in people with intellectual and developmental disabilities, how it might present differently, how behaviors are often underlying presentations for medical illnesses, and then how to address those specifically in people with intellectual and developmental disabilities. So it teaches the concepts of healthcare that many clinicians already know how to treat, but it reorients them to the different ways they might appear in people with intellectual and developmental disabilities. That particular module covers other things as well. It touches on some dental care issues. It touches on osteoporosis, a little bit about using wheelchairs and supports, things like that. All things that many of us didn't learn in our education. The third module is actually one of my favorite ones to talk about, and it's common behavioral presentations of medical conditions. And it ties together the very strong correlation between behaviors and underlying pain or underlying medical conditions. And it's done in a very specific way where it talks about specific behaviors and that are presented in numerous real-life case studies that ended up being having an underlying medical diagnosis, and then groups those into 10 different areas where certain diagnoses could point to 10 different specific types of conditions. The fourth module is dual diagnosis in IDD. We know that there are a lot of there's a lot of overlap with mental health conditions in people with intellectual and developmental disabilities, sometimes underdiagnosed, oftentimes overdiagnosed. We know that many people are placed on psychotropic medications, often for behaviors. So this module talks about mental health conditions in people with IDD, the complexities of diagnosing it. There are some included tips and information about how to make more accurate diagnoses. It goes over different classes of medications and how they affect people with disabilities in different ways. It talks about good prescribing habits, reducing polypharmacy. All of these types of issues are covered in this particular module. The fifth module is about effective communication. And it's about how to improve communication between the healthcare provider, the person with the disability, and their supporter. It teaches about the team approach because many clinicians do not understand what a team is. And they might have a person who is a direct support professional who presents to the office exam, office visit, or the emergency department with them. And that person may not know that much information about the patient sometimes. And that there's just there are a lot of things that can be done to improve the level of communication without having the time to go into all of them here. But this module really works to improve communication, talks about being respectful, speaking to the person. It talks about patient family-centered care. It talks about person first language, all of those types of things. And then the sixth module is case studies in IDD healthcare. And there are, again, numerous case studies that tie all of these different concepts together. So where is this course being used? I'll tell you, we'll start off with Station MD. They were the first adopters of the course, again, out of a need. And if you are familiar with Station MD, they are a provider of IDD-specific telemedicine services. And they use the course to train all of their provider physicians. The state of Georgia, the Department of Behavioral Health and Developmental Disabilities has access and is licensed to the course to provide freely to all of the physicians in the state. The course was turned into the eLearn course early last year, along with something else that we know that happened pretty significantly early last year, which was COVID. So that did delay the start of this, but they're ramping it up now and getting ready to advertise it to clinicians in the state, again, because of a need, because they realized through mortality reviews that many of the poor outcomes that they had were a result of clinicians not understanding how to provide healthcare to people with IDD. So they're going to provide this to clinicians in the state. The state of New York is also using it. The provider organizations, Cerebral Palsy of New York State, received a grant through the Mother Cabrini Foundation, and they are using the curriculum in IDD healthcare along with several other of our eLearn courses that teach that are geared towards direct support professionals or nurses, and to provide training to healthcare providers in the state of New York. Their goal is to reach 1,000 physicians and hopefully more, and they're just ramping that up now. There are a couple of local IDD authorities in the state of Texas that, again, realized that many people in their catchment area with disabilities were being referred to them for mental health care. And it was so often noted that there was some underlying medical condition that was being missed. So these authorities have licensed the course, and they're, again, providing it freely to healthcare providers in their catchment area to try to improve training. We have our first medical school that is using it, which is really exciting. William Carey University College of Osteopathic Medicine is using it this year in all of their first-year medical students. They did a pilot, which I'll tell you about in just a second. And then we also have another pilot that is starting, it started last week in the country of Georgia. We had some international interest in this as well, so we're very excited about this moving forward. Also, and there are individual clinicians who use it, and we'll see where this goes from here. To tell you a little bit more about William Carey University College of Osteopathic Medicine, they did a pilot in 2020. They had a number of students go through the course and surveyed them. And to try to summarize this busy slide, if you look at the bigger bars, the first one says 87%. Strongly agreed that the training would change the way they treated people with IDD. That to me is a big indicator. If someone says that this training will change the way that they treat a condition or a person, that's very important. And 13% somewhat agreed, which is 100%. So basically everyone felt to some degree that it would change the way they treated people with IDD. The next big bar, 94% strongly agreed that the course provided information that they were previously unaware of in the field of IDD healthcare. The next big bar, 81%, strongly agreed the course increased confidence in treating people with IDD. In fact, we did a pre and post self-assessment confidence rating, and their confidence level improved by 107% prior to taking this course as opposed to after taking this course. 100% agreed that it increased their overall knowledge of IDD healthcare, that it met its objectives, and 81% felt that the course was excellent. 19% felt that it was good. So very positive results. The researchers who looked at this at William Carey did present this at the American Association of Osteopathic Colleges. And I don't think I said that exactly right, but they did present this as a poster presentation at their conference this year, and are going to continue studying it. I just want to touch briefly on a few words and some of the feedback, mainly just to point out how this is being received. This one's really long, but I'm just going to hit one thing, that the course exceeded my expectations, which is excellent. But when you start reading this, after completing the modules, I appreciate a new perspective on diagnosing and managing healthcare for those with IDD. In the middle, it says, I appreciate the opportunity to learn more about IDD and how to adjust what we have learned in the classroom to better diagnose and treat these patients. This student said it was a great interactive way to learn about IDD healthcare and kept me engaged and was easy to navigate through. And I enjoyed the activity, which is really exciting as well too. I don't like to sit through boring things either. I like how clearly the concepts were laid. He includes some humor. And if you know me, I do throw a little humor in things, but it helps to solidify the concepts. I really like the way the information was presented, and the quality of this information in this online course is one of the best I've had. I thought the layout was very well organized. I like how it provided lists of questions and things to consider in dealing with patients, with people with IDD. There was good practical advice about things we can start using immediately. And that is one of the biggest things in any talk that I do, is I want people to be able to take things out of that and immediately put it into practice. And some of the feedback is showing that the course is doing that. I enjoyed studying the different cases of various medical presentations and settings where patients with IDD receive service, and enjoyed how the modules flowed, so on and so forth. The course, again, is used for medical student, or this is medical student feedback, but there are a number of practicing clinicians who use it as well. This is a physician who actually retired from the VA medical system as an internist and began working at an IDD prep program. And she said the course should be mandatory for all medical students, would also benefit mid-level providers and nurses. In fact, providers from every discipline and every level of experience would benefit from the course. This is a nurse practitioner who says all medical providers and dentists should be required to take the course. Again, she had no exposure to IDD healthcare, and it's a wonderfully condensed program full of valuable information. High yield material. Maybe in a few years she could do a second level course, which was nice. And this is from the Chief Medical Officer of Station MD. The courses were great. They're exactly what we were looking for. As we grow, we will certainly use it, and all of our providers take your modules, which they are indeed doing. A couple of common questions. How long does it take to complete? The course has a 4.5-hour run time if you ran it straight through. However, based on feedback, one of the things we did is we built into the course an ability to speed up the course, so you can actually play it as fast as double time if you can follow it along that fast. But you can adjust that, and I'm sure you've seen these types of features in YouTube and videos and things like that. So you can actually play it faster, but there are post tests that do take individual time, so it can be a little bit longer than 4.5 hours. Yes, is it customizable? Yes, it's customizable. Our company has its own in-house production for eLearn courses, because we produce eLearn courses in the field of IDD and health and sports and services. And so we can customize these individual modules or add to them. Updates, we've actually already updated the course with newer statistics and new information that has already come out, and we will continue to do that. And yes, you can add additional modules. So I'm going to stop there and see if there are any questions from anyone else.